Well, more Americans are planning to spend the holidays with family and friends this year. Health leaders say it's best to take some precautions because we are still in a pandemic.
There we are. And today the state reported the Austin Metro has 401 new COVID-19 cases. That's down slightly from a week ago, but cases in Texas are ticking upward. KVUE's Connor Board has some tips on how to celebrate safely.
We are now entering our second holiday season of the COVID-19 pandemic. This is as Austin public health leaders say COVID-19 cases are trending up.
We saw a 33% increase in the number of cases from the week before. That causes me to pause a little and say, okay, what's going on?
Right now in Travis County, 77% of people have received at least one dose of the vaccine. 95% of people 65 and older have received at least one dose. 65% of 12 to 15-year-olds are fully vaccinated, and 19% of 5 to 11-year-olds have received at least one dose of the vaccine.
It gives us more peace of mind as we know that we'll be gathering with our older generations, with our grandparents, with our parents, with our extended families during this weekend, to note that all of those that are coming together have potentially had that vaccine.
APH leaders say that booster shots and testing will be key this holiday season. You are recommended by the CDC to get a booster shot if you are 65 and older, if you received the Johnson & Johnson vaccine, if you have underlying health issues, and if you work in a place that puts you at a higher risk for COVID-19. And if you're 18 and older and are healthy, you can also get the booster shot. It's available to you too, and APH leaders say you should go get it.
We know that the immunity wanes after 6 months. And so we want to make sure, even if you're a healthy individual, that you get that extra layer of protection.
So who should get tested for COVID-19 before a gathering? APH leaders recommend those who are unvaccinated and people who have any type of symptoms should get tested. They say you should do this 48 to 72 hours before a gathering. The CDC says that PCR tests are the most accurate form of testing. It usually takes up to a few days to get your results, and it's more effective at detecting those asymptomatic cases. But antigen tests only take about 15 minutes to get your result, and they're also a good option. If you truly feel you may have COVID-19 but get a negative antigen test result, doctors recommend you do a PCR test as well, and if you test positive on either test, that's the result you need to go with. Reporting in Austin, I'm Connor Board.